Welcome to Plastic Surgery 101, another episode. Last time we had a really nice interactive session where I was able to go through different questions from the audience. Today I'm going to do it differently. I'm just going to explain a journey of someone who wants to do plastic surgery, because that's what I really get in different questions. But basically, once I've gone through the journey, then you'll be able to feel comfortable and safe to do your plastic surgery. So the first step that you're going to do once you've decided that you're going to do plastic surgery is to pick a surgeon and a center. It can be a very daunting task, difficult, bombarded by maybe different adverts. You have AJ plastic surgery popping on your timeline and you wonder where do I start? So once you've settled on your surgeon or your center, is to book a consultation and then come for your consultations, have a discussion with your surgeon. And then this is where you're going to really come and decide what are the goals, what are the treatment goals. Do you need this? Because sometimes I get clients asking me, okay, I need a lipo. How much is lipo? But when you come for your consultation, you might not even need a lipo. You might be better off doing a tummy tuck or a combination of lipo and a tuck. Or even everything can change completely. Once you come for a consultation, you might find that you need to do a breast reduction more than actually you need to do a lipo, because that breast is what is limiting you from physical activity and leading to your weight gain. Once you've settled on a procedure, we've discussed your pre-operative and post-operative care, the next step is really to make sure you've adhered to your pre-operative instructions. Sometimes we might force you to stop drinking alcohol, stop taking some medication. Of course, smoking is a no-no. Quit smoking and be in some form of good lifestyle. If it's exercise, if improving your diet and your routine, that is very important. The next step is now to plan your obligation and a time of work. So if you're employed, how are you going to get your annual leave? This being a cosmetic procedure, you're unlikely to get a sick leave. So you plan during the time, maybe you have your vacation, annual vacation or annual leave. Then if maybe you run a business, who is going to take care of a business during recovery? As I've explained before, it will take between 2 and 3 weeks. So you must have that. And then another crucial thing is transport. Are you going to get yourself to the hospital, to the clinic before the procedure that morning and after? Because the first few days after procedure, you need help. You might need either to get a cab, get Uber, or someone to bring you forth. And then the housing, the 3 to a day or 3 days when you go back home, if you have to take a flight of stairs, how is that gonna be? If you're going to, you have your dressings, who's going to assist you maybe to move around, to get your things? So you make sure you organize your room and your bedding in such a way that it's going to be easier for you. Because I can tell you the first week is usually hectic. Maybe you're doing massages, you have dressings, you're on medication, both antibiotics and painkillers. That can be a toll on your body if you're not prepared for it, if you've not organized your surrounding, so that you make it as seamless as possible during the first week. And this is where I usually get our patient coming day 5. I usually tell them between day 5 and day 7 with blues, post-surgical blues, because your world has turned upside down. You are not prepared for the recovery period, the first 2 weeks, the first week or 2 weeks. And then you imagine that you'd come for a procedure and then smoothly go back to your normal routine. And because there's that stress of surgery, stress of anesthesia, stress of being admitted, being away from your normal space, that adaptations becomes psychologically taxing, and you find you even regret. I'll be honest with you, sometimes we have to do a bit of counseling for our patients, because if you don't prepare well, your recovery becomes hectic, becomes very difficult. But if you prepare well, you actually enjoy the journey, because transformation happens. It even happens when you wake up. It happens every single day. You get better and better with your results. But if you don't have a very good social support, you will not see the transformation. So once you've sorted out your leave, your off days, you've sorted out your transport, you've taken care of post-operative environment, including your social support, you're 50%. You're not yet there. So next thing you have to think of, what questions are lingering on your mind? What clarification do you want to seek? So before you settle on a plastic surgery procedure, make sure you've counter-check, you've asked all the questions. You'd even do a second or a third consultation with your doctor or your surgeon, so that your mind is set, because healing starts from the mind, and the outcome that you're going to get will actually definitely start from your mind. Then after that, you avoid drinking or eating. If you're on medication, give an example, there are patients who sometimes they're on blood thinners or on aspirin, and some of these drugs may have to be altered or stop altogether, of course with guidance of your personal physician before you do your procedure. As I've said, smoking is a no-no. Alcohol, you have to put it on a break. A bit of lifestyle modification, then you're at 70%. Now, clothing, things that we usually don't think about, because when you come for a procedure, you must be comfortable, from your footwear to the way you do your hair, to your clothing has to be loosely fitting, very comfortable, because you're coming to do a procedure in an hospital environment. And even if during a hospital stay you're going to have a patient gown, on discharge you'll be required to go back and be on your own clothing. Now, if you had come for a breast reduction, you had huge breasts, invariably your clothing are going to be bigger than on discharge when now your breasts are smaller. If you're coming maybe from double D or more, sometimes bigger breasts, we've reduced maybe 2 or 4 kgs or 6 kgs. Definitely that tells you that you must have a different bra, different tops or different dress. Then another very, very important, and as I've said it before, is your post-operative instructions. Post-operative instruction begins from all the way from the clothing, if it's a sports bra, surgical bra, faja, to your medication. We don't want you to get infection, so you have to be very diligent, keep time on your antibiotics. We don't want you to be in pain, so your painkillers. If need, some patients put them on blood thinners or any other supplements, you have to make sure you take your medication. And the follow-up, skipping appointment. At AJ Plastic Surgery Center, we make sure that we call you a day before your appointment, even if you had already communicated to you, because that is where people you might drop the ball. You might have very good outcome surgically, very good care in patients, but when you go home and you don't come up for your post-operative care, then we might not address an issue on time, or we might not guide you, because body changes every day. If where we were at day 3 or day 4, we will be very different by the time you're doing day 14 or even day 6 months and 9 months down the line. We've come to the end of another exciting episode of Plastic Surgery 101 at AJ Plastic Surgery Center, home of plastic surgery. I am sure now we understand the patient journey, from decision making to picking your facility as a surgeon, what is expected around that area in your consultation, during the procedure and after. And I hope after this procedure now you're comfortable and feel that you're empowered to make that step and plan your plastic surgery. Thank you.